continue to talk about gastrointestinal drugs, and we've talked about how to induce vomiting, and now we're going to cover a little farther in our outline of what this chapter is about. Um, we've talked about inducing, now we're going to talk about stopping vomiting. So again, here's our drug title outline, and we've covered emetics, which are the drugs that induce vomiting, and now we're going to talk about antiemetics. So antiemetics, drugs that stop vomiting, reduce it. We have to understand that vomiting, and for that matter diarrhea, when we get to talking about that, these are both protective mechanisms that the body has to eliminate things from itself. And so we need to be careful in thinking about stopping vomiting. Obviously, vomiting is not pleasant for owners to have animals vomiting in their homes. Sorry if you heard that whacking noise. That was my dog, Ruby, whacking her tail to be let out of the room where we were sitting. So anyway, sorry. So vomiting is unpleasant, and owners will want that to stop. Now, one thing you can do, obviously, if you have an animal that is vomiting a lot, they need to come in for a workup. So always volunteer to have the owner bring the animal in, because we can so much more easily deal with it in a clinic, right? We don't have carpeting everywhere. So, so just be sure to offer that. And once we've done a workup and we know what's going on with the animal, and that vomiting is something that we need to stop. And usually there's a point where the animal is just retching, and bile acids and the stomach acid is what is coming up, rather than food and the thing that might have caused the problem to begin with. And we want to stop that. It makes the animal more comfortable. We can get them eating sooner. All of those things are really important. So here are our main types of antiemetics. We're going to go through them. I'm just going to pronounce them for you. So phenothiazine, tranquilizers, procainamide derivative drugs, cisapride, antihistamines, anticholinergics, meropetant, and Zofran. And so the first one, phenothiazine tranquilizers. These are very commonly in your clinic because they're used to tranquilize animals for radiographic positioning, other procedures, short-acting procedures. So acepromazine, or it's typically known as ACE, is very common to have in your clinics. And this was the drug that when owners would come in and say, I'm going on a trip and I need something to keep my dog from vomiting, acepromazine was the drug. We have it as an injectable, but we also have it in tablets. And I used to give the owners a trial amount. Hopefully they weren't coming in the day before their trip. And I'd give them a trial amount and have them, take the dog on a car ride and see how this affects them, because you don't want them to take off and have an animal that is in, a dangerous position of being so sedated, because these are tranquilizers. So you wanted them to determine whether what you gave them as the normal dose was going to be too much or too little. So that was what we used to use. Now I would say meropetant is the drug that we reach for, otherwise known as Cerenia. There is also chlorpromazine and prochlorperazine, and these are more human-based drugs, and again, they can be used for motion sickness. Some veterinary gastroenterologists will prescribe chlorpromazine, but for gastroenteritis, your book goes into how we have these other receptors in the gastrointestinal tract, and they may be more responsive to the NK1 and 5-HT receptor type blocking. All of the drugs that we're going to use for vomiting, for ceasing vomiting, are going to block receptors that have been stimulated to cause the vomiting. So Cerenia is probably a better choice if we're looking at chemotherapeutic vomiting. We may be looking at serotonin receptor blockers. So what do phenothiazine tranquilizers do? Well, they block dopamine receptors, and they also have an antihistamine effect. And they also can block they also are anticholinergic, have anticholinergic properties. So what kinds of receptors, which autonomic nervous system, which branch of it is most affected by anticholinergic properties? Hopefully, you recognize the parasympathetic nervous system as being the one that has acetylcholine as its neurotransmitter. And so if we block those cholinergic receptors, we're going to block the parasympathetic nervous system. All right, so I've talked about dopamine, histamine, anticholinergic. Can you determine which species is going to be better treated by phenothiazine tranquilizers? Hopefully you remembered the dopamine is more prevalent in dogs, as is histamine. And for that matter, the histamine receptors are what are stimulated when there is stimulation from the inner ear, from the eighth cranial nerve, down to the chemoreceptor trigger zone, and that will release histamine, which then can cause that effect on the chemoreceptor trigger zone that triggers the emetic center to have the animal vomit. And that's all from stimulation of the inner ear, which happens during motion. So dogs are better affected with this drug, and particularly for motion sickness. But a side effect of this drug is antagonizing or blocking alpha adrenergic receptors. So these alpha adrenergic receptors are stimulated in response to low blood pressure, and they will allow vasoconstriction in instances of low blood pressure in the body. And we talked about this before. So low blood pressure can be from dehydration, from a heart problem, from bleeding, excessive bleeding, hemorrhage, those kinds of things. And so if we have an animal that has any of these conditions, we would use this drug very cautiously in them. What it does is it blocks the reflex vasoconstriction that occurs when an animal has low blood pressure. The body's trying to shunt the blood away from organs it does not need, and it's trying to increase the blood pressure. So, and it's stimulated by the sympathetic nervous system. We'll come back to that later on when we talk about cardiac drugs. But the end result is, because phenothiazine blocks these receptors, it's going to block that vasoconstriction, and that's going to result in a drop in blood pressure. It's allowing the blood vessels to be dilated, and so it's just like if you have a big straw and a little straw, and you put the same amount of water through those, you're going to see more pressure from that smaller straw than from the larger straw. So really important, these animals need to be well hydrated before giving and during giving these drugs, and we certainly want to be careful in any cardiac situations in giving these drugs. Metoclopramide is another commonly used drug for antiemetic effects, and it acts centrally, but then it also has local effects. So acepromazine, the phenothiazine tranquilizer drugs, are centrally acting. So metoclopramide has some local effects, and that means that it's going to act directly in the GI tract. So the central effects are due to blocking of the D2 or dopamine receptors and 5-HT3 or serotonin receptors on the chemoreceptor trigger zone. So which species do you think it would work better in? Hopefully you said dogs because of the D2 receptors. They just have more of these receptors than cats do. It has this local effect in addition to that central effect, and that is what is called a prokinetic effect, and that it acts on the upper GI tract, the esophagus, the stomach, the small intestines, does not affect the colon, but what it does do is keep things moving. It affects motility in situations or diseases where stomach motility is altered from what we normally have. So one condition that it is used in is a condition that some healthy dogs that aren't fed by free choice, they're fed at specific times and their stomach may be empty overnight, but they may have a condition that causes reflux or passing back in the opposite direction as it should from the duodenum into the stomach, the bile acids that would be secreted there. And the bile acids are very, into an empty stomach, would cause a lot of irritation, and that causes vomiting. And so these animals are otherwise healthy, but they will typically vomit in the morning when they wake up, and it's just this, yucky yellow stuff that stains things and they're otherwise healthy, but we want to just stop that condition for them. So metoclopramide, it causes the GI tract to move in the direction it needs to move in, so that bile acid will not go up into the stomach and cause that. They're typically given the drug before bedtime, and that usually works to help it out. So this drug does have some central nervous system effects, and cats can become frenzied on it. So some people avoid it entirely. Additionally, because we just talked about the dopamine receptor blockage that is only useful in dogs, it's not as useful of a drug in cats. And we want to avoid it in animals prone to seizures because it does tend to induce seizure activity. Cisapride is a somewhat related drug. It's called Propulsive. Propulsid, I should say. It's similar to metoclopramide. It's a prokinetic agent. We've used it in the past in megacolon in cats. This drug has been taken off the market. It used to be, before it was generic, it used to be very expensive. But it's not that expensive for treating a cat for megacolon. So this cat has megacolon. This is just massive amounts of feces in the colon, and cats, excuse me, are very good. They're descended from desert cats, and they are very good at extracting all the water out of their feces. And it can be a real problem. It starts to accumulate in the colon, and if the cat is not, after a while, it will distend the colon, and the colon becomes ineffective as far as kind of notifying the cat, okay, it's time to go and get rid of these feces. And eventually the cat lacks tone in the colon. Sometimes surgery is the answer for these particular cats. It doesn't happen to every cat, but it will happen to some. And so we can go to compounding pharmacies and get this, but it's not available in a typical pharmacy.